Hello! If you can hear me, type 555. If you can hear me, type 555. And remember this, we are using a new Zoom link. So if you have your member who have been clicking on the previous Zoom link, right? Please let them know that we are changing to the new Zoom link. Okay? So we are in some transition period. I believe that every year we need to change a new Zoom link because of the Zoom policy. Because of Zoom policy. So now, like most of the time, right? When you go to other people's Zoom, you have to click the link and then wait inside before the host come in, right? Or you have to remember the passcode. But in our cases, do you find it's very convenient? You click, immediately go in. You don't need any passcode. You don't need in waiting room. Immediately you know you are inside already. Do you think it's very convenient? You click one time, oh, all come in already. Don't need to wait. Don't need to key any passcode. If you think it's very convenient, type 222. If you think it's very convenient, type 222. So there are some setting that we did that was quite risky to Zoom, because Zoom say it's quite risky. They always want to protect the atmosphere. So this is why he had to refresh the new link almost every year, I think. Okay, come, let's start. Okay, before I start, let me share with you a story I just received from, Tuesday, right? Tuesday. Um, and Tuesday we have this case where, okay, where this lady keep coughing, okay, with this keep coughing, and then doesn't feel good, and then I explained that if you always wake up, that means you wake up about 3 to 5 a.m. and then you keep on coughing, you have a mucus coming out, you have a flu, right? Then most likely is your lung problems. Okay, but if you say, no, no, I don't have lung problems, if you don't have lung problems, then the last thing is your large intestine problem. Okay, and then so I talk about, okay, so then Tuesday I predicted, based on what you share with me, right? Your hair getting thicker, your energy getting better, everything getting better, should be getting better. Okay, don't worry that during the healing crisis, you worry your body getting weaker. So this is her upline came back to me, say, oh, Jinlong, you predicted her easily feeling cold is due to the dampness in her lung and large intestine. Always these are two cousins. Okay, when we have a timing, okay, 1 to 3 sorry, okay, 1 to 3 p.m., 3 to 5 p.m., 5 to 7 p.m. So this is a liver, this is lung healing, and this is large intestine. Okay, so whenever you wake up at this timing between 3 and 5, right, it's lung doing the healing 80% of the time. But if you don't have any lung issue, you have no asthma, you have no pneumonia, you don't have any, you are no smokers, right, then the 20% of the chance is because of large intestine. So then your problem will be you either have diarrhea, you have constipation, and your large intestine has some surgery before. So in her cases, after the Zoom, this is almost after 2 days already. After 2 days, and then she recalled, say, oh yeah, Jinglong, you are correct. She recalled the colonoscopy doctor mentioned her large intestine was filled with too much of water. So now it's a way for the body to remove out the water. Our body always can find a way. You see, this is what I say. Sometimes the customer don't know. When we ask, do you remember you went to a very cold country and things like this? Don't have leh, don't have leh. But suddenly he thought about, oh yeah, yeah, yeah. My doctor has mentioned my large intestine with too much of water. I share with you one more cases. Okay. So this is another case. It says, Jinglong, recently I keep on having running nose, and what is the reason? I got patch ice wave, and I drink some of the fever medication. I feel better, but few days later it come back again, and it it continue to have this kind of cycle. Get better, then worse, then get better, then become worse. And recently I realized that after I shower, right, wow, I have so much of sweat. And then I say, do you wake up in the middle of the night? I say, yes, about 1 to 2 times. Okay. And then I ask, how is your poo-poo recently? And say, oh, nowadays, I keep on diarrhea, you know, 1 day, 2 to 3 times. It's very, very watery. So you see, when we have 3 to 5 p.m. healing, like the lung, right? Okay. When this one get better, for example, this is always how it works. If your body have a lot of water, your lung have a lot of dampness, right? Lung will try to repel all the water. So where does the water go? The water will go through the lung and then go through the mucus, go to your nose. Okay? If too much of water, then it will become diarrhea. Okay? So for those who are very serious cases, you will see diarrhea. But some people, they also wake up in the middle of the night, but they become better bowel already. How come? Some people become diarrhea after having healing crisis, wake up at 3 to 5. Some people, their bowel become better. Better in the sense that no more constipation, the shape is more formed. It's because for people like this, it's less serious. So the body is able to get rid through the sweat, through the nose. So when all the water has go through sweat and nose, right, your body become better. Okay, so this is the seriousness of how much of dampness is in someone's body, right? It's very hard to say, man. Like for example, these cases, right? I say, okay, wake up in the middle of the night and then he might have diarrhea. One more question I should ask is, do you feel tired in the morning after the diarrhea? Normally, the people will say, no, no, I don't really feel tired. Okay, and this is a good sign. And this is a typical way of removing dampness, very normal. Don't take medication. Let them out. If you look at your joint, do you find that you can touch the bone easier? And she actually shared with me the photo that her face looking sharper. But this is the second thing. When the water retention reduce, right, the bone on your knee also become more obvious. Yeah, now my kneecap, I can start to feel my kneecap already. They mean last time the kneecap is quite swollen. Now after the water retention being repelled, right, can start to feel the knee joint already. I said, oh, congratulations, your body is heavily removing the dampness. And then I asked, do you have any experience that the body got cold and then you went for a winter country or you in a forest, you are caught in the rain? So again, many, many years ago have, but only go for travel. That one is still young. And also, not many times that she have really caught under the rain. I say, that time, do you really cold until shiver? And do you remember at least about 2 weeks time you were very cold until you shiver? And it's 2.5 hours later I realized, because I remember there was one time when we met, and then she talked about the negative ions apparel that she stopped using it already, and then she started to see all these kind of changes coming in. Yeah, then I remember because last time she used to tell me when she was in a hospital taking care of her son, it's so cold, so she had to use the negative ions apparel to keep warm. So, and that time is about 3 months time. So I recall, oh yeah, do you remember when you were taking care of your son in the hospital, you always need to sleep in the hospital and very cold? And Jinlong, good afternoon. I'm so grateful you still remember my days that I'm taking care of my children, my son in the hospital. It's almost about 3 months. Yes, and it's very, very cold at night. Guys, can you see the trace? So when customers say, no, I don't remember, but sometimes, right, deep down, there is something that don't know. It just takes some time for them to realize. It's the same thing. That it takes some time for them to realize. Okay? Do you think it's quite magical or not? Do you think it's quite magical that you are able to understand your body to this extent that by knowing you that you got cough and then recover, got cough and recover. If you got cough on flu and then you recover, it never come back. That is infection because you build back the immunity and antibody already. But if you keep getting the flu over and over again, right, it is not infection. It is one way for the body to repel the dampness. And through this, through only this, right, we can start to say that you wake up in the middle of the night. Yes. Do you find your poo-poo is any changes? Yeah, very watery. And can you find that you can see the bone better? Yeah, I can see my bone better. And now she recall, oh yeah, that night, that time 3 months that I was so cold. Now it's removing the dampness. Do you think it's quite magical that our body can function this way? And the thing is, we can actually know about this. If you think, wow, amazing, we can find out like a detective, you type 555. You type 555. So now I'm going to show you her pictures, okay? Okay, I never asked her permission, so what I'm going to do is, um, I I will cover. Okay, I will cover. Oh, cannot lah. This one cannot cover. If cover is a bit is a bit cannot. This one cannot cover because cover already cannot see the face already. It's amazing, right? Okay. Okay, now let's start our question. So the old password not in use anymore. Okay, if you use the old link, the old passcode still can be used. But the thing is now the new Zoom link, I will send you it again. The new Zoom link, okay? The new Zoom link is this. Okay, so this is the new Zoom link. Okay, this Zoom link already with the passcode, everything in already. Okay, so you guys just remember we are using a new password, okay? Hi, Jinlong, can the patches be spread out to use in the span of 2 days for people who can't take pain when patching? Yeah, you can. You definitely can. Or alternatively, can add on one more patch at the point of pain. Xiu Kim, Jinlong have skin allergy at the location of patching. May I know which type of tape can I use to tape the patches on my clothes? Must it be transparent tape? Okay, if you want to tape on your clothes, right? Actually, why don't you patch directly on your clothing? Why don't you patch directly on your clothing? Okay, Xiu Kim, can you unmute yourself, Xiu Kim? Hey, Xiu Kim, can you unmute yourself?
Hi, yes. Can you hear me?
Okay, Xiu Kim.
Hi.
Hey, Xiu Kim, how long have you been using the patch?
Less than 2 months.
This is the first time you come to Zoom?
Couple of times, but
Couple of
only
times.
recently I started attending your Zoom.
Amazing. This is the first time you unmute yourself?
Yes.
Okay, congratulations, your first time. Okay, so since you unmute, let us go back to the history, okay? May I know what is the reason you started using LifeWave?
Uh, I started to have serious eczema. I mean, all along I have skin allergy problem and I have food allergy problem. Uh, Medicine, Panadol allergy problem as well.
Right.
So after my third jab, um, I start to have eczema.
I see. I
That was
see.
like 2 years ago. Yeah,
Right, right,
2023 around. So like it started from small patches until it just won't go away and then grow bigger and bigger. And then on my legs, is both legs especially, and one leg was swollen like elephant leg. And then it took like about half a year to 9 months to heal. And then last year, I have my second round of similar serious eczema again. Again,
right,
it's on the leg. This time, the swollen one is on the right. The first time
right,
was on the left, and then this time was on the right. So I only recovered, I would say 95% in around early June.
right,
So I started patching mid-June
right.
because I wanted to let the eczema heal before I start. I was worried about healing crisis because my body is very sensitive.
I
So sure enough,
see. I
after I
see.
started patching, I was congratulating myself. Nothing happened. Less than 2 weeks, I started to have rashes on my hand.
Right,
And then few days later, that means into my third week, I started to have sore throat, uh, pain in the throat, sudden pain in the throat, and then it dragged on for about 3 weeks. I
right,
have phlegm for 3 weeks.
right.
Yeah. it started with yellow phlegm and then become greenish and then it's like lung infection kind of phlegm, like
I
during
see.
COVID, that kind of lumpy phlegm for a few
Right.
days, for about a week. Then after
Right.
that, from green to yellowish and then started, now it's like very, very little, but still sometimes it's a bit sticky in the throat.
I see.
Yeah.
I
And then
see.
my
Okay.
allergy on my leg started end of third week, around end of third week. The allergy was quite severe.
Right.
On my both ankle was very severe. And then it started upwards towards my
Right.
knee. Uh, it was quite dramatic because I just healed my second round of serious eczema.
Right.
I was actually very, very
Worried.
yeah,
Yeah. Yeah.
anxious about it spreading again and become serious, another round of eczema. So
Yeah. Yeah. Yeah.
fortunately it didn't.
I see. I see.
I
Okay.
also tried another device
Yeah.
and it helped me to calm down and heal and then improve my emotion.
Right.
So yeah, I'm in desperado. So just try whatever people recommend.
I see.
So
The device
finally
using, yeah, the device using is Healy or any other device?
is Warren's Love Pet.
Okay. Okay. Can understand. Okay. And then you say something? Your hand something?
So my hand is now okay, but some old patch from the previous eczema that the scar is still itchy because I keep scratching it, I think.
I
So
see.
the
I
legs
see.
are on the recovery mode, but
Right.
I think the couple of days ago during the Zoom, I heard that basically there are 3 rounds of uh, healing crisis. Wow.
Right. Right.
So that sounds a bit depressing.
Yeah.
So
So yeah. Yeah. You are right.
now my problem is that when I patch on my skin at the back of my neck, now
Yeah.
actually I got a big scar because of the patching.
I
And then
see. I see.
on my tummy also, it keep having a bit tiny of rashes, so I have to keep move it around.
Right.
And my on my right foot where I patch, try to alternate Aeon, also got rashes.
Right.
So I'm been advised by my friends who's using Lifeways and my friend who recommended me um, can alternate by using patching on the clothes or use a scotch tape to secure it on the clothes.
I
So
see.
I'm
Okay.
I'm
Okay.
wondering what tape
Okay.
to use. Yeah.
Okay. I see. I see. Okay. I understand where you're coming from already. So, Siu Kim, before this, I just want to share with you, right? Anyone who have a history of eczema, as the body heal to a certain stage, your body always flare up to remove the residual toxin. This one we have tried all sort of way, ginger water, ginger paste. I tried different kind of like a cooling down powder and all this, right? You know, when the body really want to remove the toxin, right? He really want to remove. So I just want you to have faith in it. Don't worry, we are always here. But maybe one day it's going to happen. So I just want you to know. But if that thing happen, okay, what you can do is, uh, let's say for example, this thing you start to flare out, but it will subside, right? So this is the good time. This is the lucky one. Sometimes you get flare up to a more serious extent. So just bear in mind, every time with the flare start to flare out, right? If 2 3 days still continue to flare out, you're very worried, right? You can always reduce the patch in terms of hours. So instead of 12 hours, you reduce to 6 hours. So let the body detox at a slower pace. But if you want, don't worry, I want to go straight, really want to pass this stage, then you continue 12 hours, that is perfectly fine. Okay. So um these past 2 months, right, despite that there are some healing crises, like you got the phlegm, because the last time you have some lung issue, and then your eczema flare up a little bit, is there any positive changes that you've seen? Like people say you look better, you look brighter?
Um, I start to feel my hair texture change these few days.
Your hair or hand?
Hair,
Hair
my hair
textures, okay, it means getting darker or getting smoother or getting thicker?
stronger
Stronger.
because I
Oh,
used to have
okay.
very light hair. My hair texture is very light and fine. So
Amazing.
now I feel the texture is tougher.
I see. If your
Yeah.
texture getting tougher, then very likely your liver and kidney both getting better. Do you find that your nail also growing stronger?
Uh, I haven't really realized.
Realize that.
But
Okay, okay.
yeah,
But
I have a fungal nail, so I'm monitoring whether the fungal can cure by itself or not.
yeah, so I believe that last time your liver might have some problem. This is why it really couldn't detox. And this is why you got skin problem, your skin is thinning, and then you got fungal nail. All these are related. So
Yeah,
when
I
you
have
start to
fatty liver.
okay, okay, okay. Is it serious?
Uh,
Which stage?
I checked before COVID. They say is the index is quite high, but
Quite
since
high.
then I haven't done any blood test or any test.
I see. Okay, I really want to congratulate to you. I think eczema not something that we worry about. It's the liver problem that we want to worry about. So when you start to see, you start to flare up a little bit, your that means the toxin is removing quite pretty quickly already. So the liver, the toxin load is reduced. Then only then it can store more blood. When you got more blood, you start to see the hair will become thicker, shinier, more stronger, not easily tear. And the fungal nail is really because your liver has too much of toxin. So this is why it manifests in the nail. So when you start to see your nail getting better, now if you look at your nail, right, do you see the fungal is dissipating, like the color is getting lighter, and the surface of your nail is getting smoother?
Yeah, I do realize there is some slight improvement. Yeah. I'm still monitoring whether it can continue to improve or not because
I am
the
so
texture
sure.
of the fungal nail, the particular
Yeah,
fungal fingernail,
yeah,
uh, is it looks
lighter,
more
paler, look paler.
normal,
Yeah.
and less out of shape because it used to pump up a bit. Yeah.
Yes, yes.
So
Ah,
it
amazing.
yeah.
Amazing. So, Suking, this is the important thing. So, I think that the eczema, whether flare up or not, right? That was not the most important thing. The important thing, we have to rescue your liver. In order to rescue your liver, the body have to through the skin to detox faster, and then your liver is going to get better and better.
The other thing
Okay.
I observe is my appetite is getting better.
Hey, you jumped the question already. I'm going to ask you this. Okay. Okay, your appetite getting better. Can you explain in detail how was your appetite look like last time?
Because I have chewing problem,
Okay.
because of dental issue, and also another question I want to ask, by
Yeah,
the way, is
sure.
also I keep having my teeth's root um
Okay.
has a pus coming out, producing pus out from the gum. And this is a problem that many years ago when it started with one of the tooth like that, the doctor told me it's called internal resorption, and
I
there's
see.
no way, nothing they can do about it.
Wow,
Um,
amazing.
so
Amazing.
it's happening again.
I see.
So that is one of the dental issue I have, and beyond above that, I have some other chewing problems. So um, I feel nowadays I feel hungry easier, and I feel the urge to want to eat
Yeah.
uh,
Wow,
much more than earlier on because I
amazing.
actually these few years I lost quite a lot of weight. Yeah.
Amazing. Oh, uh, may I know why you will automatically tell me you start to feel hungry? Is it because you have listened for past few Zooms?
Yeah, you always ask this question, and it was also very obvious for me because I keep wanting to eat. You see,
Amazing. And are you eating white rice?
sorry.
Are you eating white rice?
Yeah.
Okay.
Follow you people's instruction, and also I also find that brown rice I got bloating problem also. So yeah, white rice actually I have bloating problem as well. But nowadays I find that the bloating problem for white rice is not so severe. But I will pass out gas. Yeah,
Amazing, amazing. That means now the digestion is getting better already. Okay. And okay. How old you are, Shukim?
60 plus.
60 plus. So okay, so we need 7 months. Minimum we need 7 months. So this eczema, you see, a lot of people when have eczema, right? They always say, it's okay, let me take some cream, aloe vera, do some gel, let it subside. But the thing is, it subside, it doesn't mean that it solve the problem. It's just like a vehicle, it's just like a handphone, right? It's just a handphone. Okay. If the RAM is 3 gig of RAM, if you take photo, listen to the call watching YouTube, right? Soon it will run out of the memory and then it get hot, right? And a lot of people is trying to say, oh, it's okay, I wait him to cool down. So I don't watch video, I don't watch YouTube, I don't do anything, let the phone to cool down. But this doesn't solve the problem because the problem is the internal memory is not enough. So if you don't increase the internal memory, when you do the same work again, it's going to flare up again. The reason the eczema subset right now, you feel you recover, it's not because you recover, it's because you are intentionally slowing down your body activity. So same thing like eczema for most people. You see, a lot of people they say I have been 10, 20 years already. I keep my eczema in control. Whenever I eat seafood, it will flare out. That's why I avoid all the seafood. I don't eat nuts. I eat very little. I drink some juices and vegetables. They do this for 10, 20 years already. So this is not a right direction. Is that when people got eczema, they got two options. One option is head on. Okay, I'm going to put a pad, let all the toxin comes out. I will take care of my diet. I will go under the sunlight, do breathing exercise. I will make sure I move my chi. I will make sure I move my bowel, and eat white rice. Taking a proper diet. I will let the toxin remove as soon as possible. I know it's going to come, but what people take 2 weeks, I want to finish it in 4 days. So this is one approach. The second approach is those people who have fear. It's okay lah. I don't want to flare out. So they will only do things marginally, not to trigger the eczema. But that is not the way of life because it will make your life very miserable. This cannot eat, that cannot eat, cannot go to travel. You feel very scared. Whatever you do, it always carry a fear with you. I don't want you to live like that. I want you to go to the light side. So in the next 7 months, right? If you have been eating diet, appetite getting better already, as long as you stay away from all the food that I say you don't take, no nuts, no dairy, no fruit, no salad, no sashimi, your body is going to heal better. But the eczema is still going to flare out. But if you have seen results so quickly for the past 2 months, right, the skin flare out, it will not last too long. We have 3 flare out. The first flare out, it may be the longest, but the good news is if now you already have a flare out, but it subsides pretty quickly, right? Most likely that the second and third time, the healing period will be shorter and the intensity of the flare up will be even less. So day one is still okay. But in the case that something really flare out, just remember what you say today. Your hair has become thicker, become texture is different, become stronger. You does see your fingernail getting a little bit of changes, not so abnormal shape already. You used to have liver problem, now the liver is getting better. You used to have bloated, even eating white rice. Now you feel appetite is better. You get hungry more easily. That means the body can absorb more nutrient already, and soon you are going to see the whole transformation already.
Okay, thank you very much for
Thank
encouragement.
Okay, don't
Uh,
worry. We are here. We understand because sometimes when people, okay, I'm going to show you this photo. Okay, this is by Hong Kong one of the member. Her name is Sarah Lee. So same to her is very scary also. And whenever she got stressful, right, she will got this kind of problems. Okay, everything will get flared up. Okay, and then it will take months to heal. So steroid, TCM supplements. But now you can see really recover a lot already. And now you can see even the skin complexion also changing, right? Not just the scar is disappearing. You can see the skin also getting fairer. So this is what life can do to you. It's not just removing the eczema, it's the underlying causes, build back the digestion, remove the toxic load in the liver, and then improve all the circulation. So everything inside out, you get better. But I need 7 months. Okay?
so you are saying that the three healing crises may
Yeah.
happen within the 7 months.
Yeah, correct.
Wow.
Okay, don't worry. I 长痛不如短痛. Now this 7 months you finish already. After these 7 months, right, you will be have a very happier life already. Okay, let me ask you personally, right? Do you find that because of the eczema, right, you do things become very conservative? I don't dare to easily eat this one. When I go outside to eat, I cannot eat this, I cannot eat that. When I go to travel, I need to take care of this, take care of that. Do you have this kind of restriction?
Yes, yes.
Right?
In fact, during my eczema, when my leg is swollen, I practically cannot go out because I can't wear shoes.
You are right. You are right. So this is why 我们长痛不如短痛. I understand the pain for the eczema patient because if you want to live with this for the rest of your life, imagine this, you'll get older and older, right? If you don't choose the healing crisis way, you'll go another way, right? You're going to have the next 20, 30 years. Sometimes you go to travel, suddenly swollen, you cannot go out, you sit at the hotel. I don't think this is how we want to spend the rest of our life. So don't worry, go through the healing crisis, invite the healing crisis, be welcoming and receptive. This is the intention I want to tell you this. So just now you talk about which tape. Any tape is
The
fine, but you can actually tape, just put the patch stick inside of the shirt also can.
oh, okay.
Yeah, they make even the patch go the other way around, it work the same
Oh,
way. You can patch inside the shirt.
oh, I see.
Yeah.
Okay, so if I patch outside the shirt or inside the shirt, so if I use a medical tape that is beige color, those that's not transparent one to tape on my clothes, can also. Huh?
Okay, so far I personally, if you want to patch on outside, then it's better. Then you can use the scotch tape because but if you are patching from the inside already, if you
Ah,
still want to use the scotch tape, I think should be fine because our patches it can even work through multiple layers of clothing also. But the best way is just patch on inner shirt without any scotch tape.
okay, okay,
Yeah, yeah,
okay,
because it itself is very sticky already.
okay, okay.
Okay,
So the
thank you.
reverse,
Yeah,
okay,
you say
yeah.
something.
So the reverse also work equally. No?
Yeah, the reverse also work equally. And do you take your photo of your face?
I can't remember. I think I did just couple of days after I started patching.
Okay, okay. Remember, you take a photo, you're going to see changes because when you start the digestion get better, your body can move the chi better. Do you realize these 2 months you can sweat better?
Yes, yes.
Okay, this is something huge. When your digestion get better, you can sweat better. It means the whole detox symptoms start to move around already, and sooner you start to see your cheek getting sharper. You will start to touch your joint better already. No more water retention. All this is going to come.
I have one more question.
Sure,
Just a quick
come,
one.
come.
Um, for someone who's close to me,
Yeah,
cancer patient,
yeah,
esophagus cancer,
yeah.
already gone through operation.
Right. Oh,
Uh, yeah. So will because I'm very hesitating to recommend things to him because
right.
I ever recommended to him before, and then later I realized that device cannot be used for cancer patients. So
I
from there
see.
onwards, he has
Phobia.
this yeah.
I see.
Anything
I
from
see.
me is like doesn't sounds good.
I
So
see. Okay.
I'm just wondering whether is LifeWave suitable for this kind of patient.
Yeah, live is definitely suitable, and but because at the end of the day, it's still the personal trust between you and him, right? So, like right now, your nail, your hair, right? Those who have started to see the changes, you have to do more documentation because later on, when you help him, I can say, see, I know previously I introduced you the not the right product, but now I have tried the product. I have confirmed suitable for cancer patient. This is my result before and after. So this is one way to really, really get back the trust. But LifeWave is safe. We have a lot of cancer patients also using the LifeWave patches, even doing chemo, radio, immunotherapy. They are using LifeWave patches to maintain their health, and they are not suffering the side effect from those cancer therapy.
Okay. Okay, I
Mm.
guess I don't want to take up your time too much.
Sure.
If
Thank you,
I
Siu
manage
Kim.
to convince him, then maybe I can try to bring him online Zoom,
Sure.
and maybe you
Sure.
can coach him and let him know how to patch or what kind of
Sure.
patches
Sure.
build confidence for him.
Sure. The patch is always X39 and Eon first,
Okay, even for cancer patient.
even for cancer patient.
Okay, all
Okay,
right. Thank
thank
you
you.
very
Take
much.
care. Take care.
Thank you.
Amazing, right? So you see, we have to always prioritize the young person, like 20 over years. So this is always my goal. And the second is those people who just use for 1 month, 2 months, because it takes so much of good luck and good karma for you to meet life with. So now 1 to 2 months only, and flare out can easily make people break your confidence in life. I've seen so many times, but I'm so sometimes even I think about this today. I said, few years ago when I first started, right? Because no one really guide me how to explain this. It become very fearful. I sometimes even the one time I even fearful to talk to people about life with. Jialat though. Every morning, how come I so itchy already? How come I so painful? How come I cannot sleep? How come I keep coughing? How come I got fever? Anyone had this feeling before or having this feeling right now that jialat oh, now maybe don't dare to introduce already. All the healing crisis is like, oh my goodness, very scary. Yes, that 555. Though you had this experience before or you are having this experience with that 555. There come to the time all the healing crisis, oh my goodness, I don't know can talk to people or not. Guys, is normal to be like this. And if you only focus on X39, for cases like eczema, it flare out very quite serious one. But as long as you faithfully drink enough water and put ion, the flare out won't be so much. It will flare out later and come back very quickly one. Guys, for those of you who have been here for about 2-3 years, right? Do you remember last time before we focus on X39 and ion, right? The skin recovery healing crisis is very unmanageable one. Wow, flare out a lot aloe vera also cannot But after we put ion do you realize for the past 1-2 years, when you heard about the healing crisis, right, are always coughing tired acid reflux dizziness pain we seldom hear about the skin problems already. Do you realize? If yes, type 222. Do you realize? Last time when we focus on X39 alone, right? Wow, a lot of skin problem. Every time complain one. But now, if for the past 1-2 years, we never have skin problems, healing crisis that is too unmanageable. This is the power of Eon. This this is the power of Eon. Okay, because when your body is, you see, it's like you going to KL from Singapore going to KL, right? If the KL road is jammed, you will find shortcut. Same thing. If the liver cannot detox, so when delivering the toxin, right, it will remove through the skin. But when you have Eon, you calm down the nervous system. It's like you go to the road, right? Even it's jammed, right? Your driver is very calm. It's okay lah. I don't need to look for shortcut. I don't need to kanjong myself. I'm going to calm myself down. I know I'm going to reach the same place again. So when you calm yourself down with the Eon patches, your body go through the nature intended detox route already. Okay, this is the power of Eon. But anyway, I just want to reconfirm what Shu Kim has said. 2 months of using Life Wave, skin eczema problem, flare up, subside already. And then she said that my hair texture become better. And through the hair, we know that the health of the hair or loss of the hair or growth of the hair is liver, the color of the hair is the kidney. If the texture has changed, they mean become healthy overall, it's the liver and kidney. So most of the time is liver. So here she said, yeah, I got liver problem, I got fatty liver. So if you got liver problem, it means that your nail also got problem. Yeah, my nail got fungal nail. Oh, do you remember? Do you notice that at least the fungal nail there is getting better? Oh yeah, it's really getting better, not so abnormal already. Okay, and all kind of skin problem. What is the root cause of the problem? Is digestion. Okay, and she said, I eat brown rice, sure got bloated, so I don't eat brown rice. You see, brown rice easily get bloated. How can it be good for you? And take white rice also bloated. But after putting the patch, now I can feel hungry already. I want to eat more already. Last time I don't feel, now I can eat more. And the important thing is when the digestion get better, the chi move better, there will be one more additional benefit or positive improvement. What it is? When your digestion get better, you can eat more, you got appetite already. There is one more thing. It's important. What is it? Make a guess. Besides, yeah, now I feel hungry, I can eat white rice, I don't have bloated. There is one additional symptoms, a sign that you have a better digestion already. Come, guys. Oh my God, I talk so many years already, We go. Yokin is right. Congratulations, Yokin. You are the only one. Luckily, it's okay. At least got one person. Perspiration, Lydia, you are right. So the key is perspire. When the digestion get better, last time you don't feel hungry, now you feel hungry, your chi move better, your body can bring the dampness better, you can remember? Do you guys remember? I always say this thing, remember? You see, also happened in her case. Amazing, guys. Amazing. Okay, come, let us continue. Okay, Christine Lau, Jinlong, my mom has swollen both feet since April. Went in hospital 3 and 2 months. Water removed after 2-3 days discharge. Then came back again swollen leg. I patched her X10 for the beginning until now about 4 months. I added EE for her feet below, but still swollen again. What are the patches you will recommend? Okay, Christina, Can you unmute yourself? Christine, can you unmute yourself?
Hello, Jinlong.
Hey, Christine.
Yes,
Okay,
how?
so your mom's
Mm,
swollen feet is only recently after the patch or before the patch already swollen already?
Before the patch already swollen already. So we send her to A&E.
I see, I see. Okay, okay. And this swollen is the entire leg swollen or only at the knee?
From the bottom to the knee there, below the
I
knee.
see, I see. Then it's heart problem or kidney problem. No matter how you withdraw the water, it's not going. Is the leg will getting weaker and weaker the more you withdraw the water.
Yeah, that's right.
Yeah. And do you find that this water swollenness has affect her day-to-day life or only doesn't look good?
Now, actually, doctor diagnosed she has heart failure.
Yeah, heart
Yeah,
problem, correct.
yeah. Then later on, admit again. Another doctor say kidney failure. Yeah. So many doctors tell you lungs, after tell you lungs, wait tell you heart, last one tell you kidney. So my mother will play around, you see.
Oh my goodness, this is
Yeah.
really a real joke, real joke. Okay,
So you see, after
yeah,
she came back and then 她很喘 difficulty in breathing.
yeah,
Oxygen very low.
yeah,
So one of my friend, how we started is one of my friend put
yeah,
the EE on her chest there.
yeah,
See? Then after for about I think a few hours, she feel better already.
right.
Then what happens? She can take bus and we go out. Go out and gai first.
Wow, amazing,
After the
amazing.
EE patch lah.
Yeah,
See? Yeah. So
and
after that, what happened? That means her foot is always swollen. Go to hospital, remove the water already, came back a few days, still swollen. Until today also swollen.
yeah, for sure. Because okay, let me think about 1 minute. Okay, it just like now my ceiling has a lobang, has a hole,
Mm.
leaking
Mm.
the water, leaking down. So
Yeah.
I put a pail to collect the water.
Ah.
Okay, if you never fill up the leak, right, your continue is going to fill the bottle, right?
Oh.
Yeah. So what the doctor is doing is he can't solve the main problem. He can only keep throwing the water, but the
Yes.
water coming from the ceiling, right? When it dries up, they mean the tanki dries up already. Then no more, lor. But this is what is going to happen every time when your mom take out the water, right?
Yes.
That is actually a essence of the body. So your mom will get weaker and weaker. The leg is going to get weaker and weaker. So every time
Mm.
we move, the next time, oh, how come getting weaker and weaker? So let us work on more patches. Okay, so when you say your referrer put energy enhancer at the lung one and then feel better, did she continue?
Now lungs because now her breathing is much better already.
Okay,
She can even go up. I find that her breathing has improved. Now it's only on her leg. So
I
you
see.
think I can patch EE on her leg there, 脚板那边?
Okay, I think for her case, right, 脚板 is definitely important. Okay, but you put two pairs, so one at the lung, one at the bottom of the feet.
Oh,
And is her appetite good?
oh yeah, very bad, very bad.
Very bad,
每次说没有胃口. And then her throat, she said her throat like cannot swallow like that.
I see, I see. Okay, so what we do right now, we don't put the patch at the kidney one, which is below the feet. We don't. My most important thing is always the appetite. The appetite has to be good. So you
Yes,
put energy enhancer at ST36 below the kneecap.
below the kneecap,
Yeah, ST36 竹山里 ST30
珠山里, okay, X39,
no no ST39 sorry ST36 using energy enhancer.
okay, 左边右边, okay, energy enhancer, That
Yeah.
means one pair will do,
Yes, you focus on this EE first, but I think the lung one, right? Although now he feel better and then he can walk more already, but still restrict her activity because if the heart is weak, if you because your lung can handle, but your
Mm,
heart cannot handle. So
yes,
that means if you can reduce the activity, right, you give your body more time to remove the water by itself, right? Your body can, but if you put the pad, you get energetic, you want to walk even more, and then your heart don't have any more energy to push through the water. Then it become a vicious cycle. It's supposed to be the good thing, but it turned to be a bad thing. So we had to start to restrict her movement already. Don't let her to walk too far. Don't let her to jalan-jalan too far. Give me about a couple of weeks time. Let the body build back the appetite. Only when her appetite build back that she can start to eat. She feel hungry. She can start to sweat. Then we got the green light for her to move around.
Oh, okay.
Yeah.
That means
Yeah.
temporarily just put the 竹山里的 there. Yeah, she
Yeah.
has
You are right.
very poor appetite. 她每次
Yeah.
看到东西，她会这样，会
Yeah.
吐
Yeah.
这样。
Yeah, because the whole body. Okay, maybe okay, guys. I'll explain to you this, right? Why I say when you got water retention at both knee together, if only at the kneecap swollen, it can be healing crisis of the joint for gout problem, got rheumatoid arthritis. But if the both feet also swollen, it means that is internal organ problems already. So mostly is heart or the kidney, because heart is the one who need to pump the blood and the water. Anyway, water is inside the blood, right? In the blood vessel, so had to pump down and then continue to move it up again. But if your heart is not strong enough, right, they mean the
Yes.
water go down is more, go up very little. So this is why you got water retention. Second thing is because of kidney, because kidney filter the toxin and then get rid of all the toxin and then keep the water, keep the nutrient and good thing inside the body. But if the filtration is not good, they mean a lot of toxin is still keep in the body. So this also cause water retention. But even you got kidney and heart problems, right? Some people they got kidney and heart problem, but they don't have water retention. It's because they have a good digestion. They have a good
I
spleen
see.
problem, which is digestion. Because 脾主运化, they mean the spleen functions
The
is
spleen.
is focusing on the movement, the circulation of water. So
Mm.
even you have a heart problem, but if you have good spleen, right, it takes time, it's going to recirculate. So now, if we can fix the appetite, the heart and kidney will stop degenerating already. So now the focus is don't care about the swollenness. I would say if doesn't affect her, don't go and
Okay.
pump the water already. Just
Yes,
focus on
yes.
energy enhancer. Hopefully he get back the appetite. Remember, you can always start with porridge, chicken porridge, fish porridge, whatever is easier to digest. Marmite is a very useful tool for people really don't have appetite at old age.
Oh, really? Huh?
Yeah. You okay?
Okay.
But
I
please
try.
promise me, okay, when you try already, I think you are going to see result in few days time. You'll come back.
Oh,
Okay. So
I
energy
come back
enhancer
to
number
you.
one. Yeah, come
Yeah.
back to me. Share with us. Appetite important. ST36 energy enhancer. You can start to eat softer food like porridge. Some people they eat porridge with beef, with chicken. Not like this. So chicken, you can make it shredded chicken, easier to digest, easier to bite, and
Okay.
you need a little bit of umami to reactivate. So the best way is what? Just now,
Marmite, huh?
Marmite. You use Marmite.
Okay, I try.
Okay? Try
Yeah.
Few days come
Thank you
back
so much. Any
Thank
improvement, I
you.
come back to you, Jinlong.
Sure. Please promise promise
Yeah, promise. Thank you. Okay,
Okay, thank you.
bye-bye.
Thank you.
Thank you.
Bye-bye.
Bye-bye.
Guys, it's amazing, right? Why do you need to see doctors? You look at the water retention, for sure it's heart or kidney problems already. You still need to talk to the doctor. And the doctors, one say kidney problem, one say lung problem, one say heart problems. Don't need You do all the scanning, all the blood draw, all the urine test, all the MRI, all the X-ray. But if you have the basic understanding of health, like what I say just now, right? You look at water retention, a symmetrical water retention, you know it's heart and kidney problems already. I don't even need to test. I know it's kidney and heart problems already. Do you think there is a much more efficient way in healthcare rather than all the testing, all the X-ray, all the MRI, they spend thousands and thousands or millions and millions to invest? We can just have a little bit of understanding. We can save all those kind of things already. Amazing. This is what I want to say. Is the understanding that is lacking right now. Okay. And remember what? No matter what are the problems, right? When you keep on withdraw the water from the knee, the leg get weaker and weaker. You know why? Okay. Imagine this is okay here. Okay, so imagine this is my heart, okay? So this is the water, this is the drain, okay? Okay, it will go this way. So whenever you pump, right, Whenever you pump, the water will come down. Okay? Pump down. And then if the water volume is enough, the water here also go up. So it will move, boom, move, boom, move. Right? But sometimes your heart is very weak. So it pump a little bit, only the water go down because you pump plus gravity. But because the pump pressure is too low, it cannot transfer to the another end. So the water here move out a little bit, comes down because it's counter gravity. So this is why more and more water stuck over here and get water retention already. Can you follow? If yes, type 555. Can you follow? This is a basic understanding. Let me tell you, doctor don't know one. Doctor only say you got water retention, heart problem. Why you got heart problem? They don't know. This is the reason because heart, when you pump, on one way is following the gravity. It always go down for sure. But if the pressure is not strong enough to drive through the pressure to recirculate the blood back to the heart, then it will counter the gravity. The gravity will pull it back. So it will start to stagnate at the bottom of the feet. Okay? Anyway, fake the digestion, all these will get soft. You don't need to withdraw all the blood. You don't need to withdraw all the water at the knee. Okay, if leg pain, I patch EE at the bottom of one of the leg, then back pain, I patch EE at the back. Is that okay to patch two of it? Yeah, you can definitely do that, Osh. But I want to share with you, if you got leg pain, you got a back pain, most of the time it's the back pain that contribute the leg pain. So you focus on the back pain first. Okay? Make sure you look for the most painful spot at the spine there, right beside. Okay, and then put EE. And then you try for a few days, then you will feel, yeah, I think my knee pain get better already. Okay, start with this first. Tiffany, lipoma, new client only want to try Eon. If she use it daily, do you think what could possibly be helpful for this condition after a month? After more discussion, client share experience, a traumatic experience or thyroid, went for surgery, cause other method unhelpful. Seek your opinion while I take note on her. Okay, so if someone have removed their thyroid, right, just have to be bear in mind that it's going to take longer time to see the result. Okay, because your body need to find other way already. And I strongly suggest X39 and Eon. And I don't know what is the reason she only want to focus on Eon. Just let her know that we have already done the 90,000 customers already, and she doesn't have yet. Okay, just follow us first. The thinking has been done, the experience, the problem, the mistake have been made, the problem has been solved. Just trust us. Okay, just trust us. Okay, anyway, there's only 1 month of money back guarantee, right? Okay, you cannot buy all Eon and use Eon, right? If you buy a core package, you cannot buy 6 Eon, right? So what for to waste it? Why don't you put X13 and Eon, and then at least you can use both together for the first one month. Anyway, if 1 month you don't see the changes, you can money back guarantee. Okay, arthritis, rheumatism. Okay, rheumatoid arthritis. Can you explain how Eon may help if client only want to use this patch without X39? Okay, to be frank, right? Okay, Eon is definitely can reduce some pain, improve some sleep, right? But the moment she stop using the Eon, right, the body is going to go back to the problem pretty quickly. Okay, it's because a nervous system is something that you keep on trigger your imbalanced nervous system every day because of the stress. So Eon is like everyday counterbalance. Okay, but X39 is different. X39 is retrain your body mechanism to cope with the stress fundamentally. Give you examples. My phone always feel hot when I call for a long period of hours, right? So I can use a fan to continue to cool it down. Okay, but the moment I don't use the fan, it will heat up again. Am I right or not? However, if I heal internally to improve the RAM, to improve the memory, to improve the processor, so now even I talk to my wife for a few hours, I watch YouTube together, right? The phone doesn't feel hot already, right? It's because it has changed intrinsically already. So the fan is the Eon, working from within is the X39. So really need to try X39, and I hope you pass my message to them. Do you remember? Can you faham this metaphor or not? Can you faham this metaphor? That means the Eon is the fan, okay, and then X39 is the key that go inside to build intrinsically make it healthy. If yes, type 555. Fungal and ringworm. Client use Eon and X10 for treatment. Will Allah help? And what suggestion? Okay, fungal and ringworm attack. All kind of fungal problems is all digestion problem that if it's on the nail is liver, also because of the digestion. If the fungal is in the blood, then the acid juice is too weak already. It's also because of digestion. So it's going to take some time, but remember he has to take white rice. He has to take white rice. Hair drop, no change. Use X39 more than Eon for 3 months. To add on S49 now, I'm using Alavion alternative. Okay, so Tiffany, I think you are one of the first time I see your name. Tiffany, can you unmute yourself, Tiffany?
No lah, I have asked questions before. Yeah.
Okay. So all these
Yeah.
are your customers?
Okay, first two customers. The third one is my son, teenager.
I
Probably
see.
recently the weather also is very hot lah, humid lah. So out
Okay,
in the school, yes. And then for
I
hair
see.
drop is on myself because I thought I used for 3 months. I thought, hey, probably hoping to see some changes.
I see. Okay,
Mm.
don't worry. Okay, for your son first,
Mm.
if X39 Eon for 3 months already, right? The fungal ringworm for young, I think your son about 20 over years old.
No, 16. Oh, okay.
16.
16, 60. Wait, this fungal and ringworms is only recently lah.
Ah,
I mean, of course, once in a while, I think weather, and I can't deny that digestion sometimes. Yeah, but more on the weather when it's very hot. I noticed like there were a few times, but then because right now is the fungal kind of like spotted.
okay.
Yeah,
Okay,
then
I
I
see.
also saw ringworms a bit, so a bit
Okay.
worry on ringworms. Yeah,
I see. The digestion is definitely the key.
digestion.
Make sure he take enough rice. Make sure the
Yes.
diet is enough. Don't eat those kind of mala food lah, mala
Yeah.
xiangguo, those kind
Yeah.
of steamboat. You know, all these kind of things your body can't digest.
Oh,
Yeah,
okay.
remember. But you see, 16 years old.
Very good appetite lah. One thing is
Yeah,
always want to eat a
yeah,
lot.
yeah. So just remember, eat proper food. Not
Proper
appetite. Go
food.
eat Maggie mee, all
Yes.
this kind of thing.
Okay.
It will get better because for 3 months, for 16 years old, right? Fungal should be finished by now already, unless the
Uh,
water is not enough.
oh no, fungal just happened about 2 weeks.
Oh, only for this past 1 2 weeks, is
Yeah,
it?
yeah.
I see. Okay. So last time that she had all this problem?
Not often. It's just that okay, for digestion since he was born.
Yeah.
Yeah. Then
Oh, okay.
I mean, yeah, kind of like running in a while, but his bowel is okay. Appetite also okay.
I see.
Yes.
And just now you say since young time he got digestion problem. May I know what do you mean?
I mean, since infant, always got to take colic, take the what drops, yeah,
Ah,
驱风, yeah.
I
Then
see.
didn't want to take proper food lah, toddler time.
I see. I
Yeah, 没有
see.
胃口.
Okay.
Then a lot of formula milk
I
until
see.
yeah, allergist specialist did remind me that to stop
I see.
take
I see.
food lah, proper food. Yeah.
I see. I see. I see. Okay. And then for the past 3 months, what is the biggest changes happen on your son?
Actually, after using Eon and X39, I find that okay, he has this. I don't know whether it's you call it sinus or things. It is
Yeah.
it kind of run in the family. Last time I also had it. Every morning we had to clear mucus.
Yes.
But then now it's better, as in he just need to clear them, then he'll be fine. In the past, he tends to get flu easily.
Wow, that's very good. This is a big changes already. This definitely will reflect on his academic focus also.
Yeah, that's the thing. Also, he always I also worry, on the learning part lah. But then I
Yeah.
don't. But for this, I cannot say anything yet lah.
I see. Okay, this one I'm very sure because I myself I am a patient of sinus before also.
Oh.
It's very difficult to study because every day he ho bring a
Yeah,
tissue
yeah.
paper
Yeah.
every day, and then you can't focus, and then you got the nausea. So
Yeah.
difficult. When this get better, the life change a lot already. Sinus is one of the most, for me, it's the most not life threatening at all. It's the
Yeah.
least damaging to health, but it's the most damaging to life quality.
Yes. I
Yeah.
agree.
Okay. Don't worry. Remember to wear long pants during your sleep, during his sleep.
But then it tends to perspire, the kneecap thing. Then the allergy or fungal, I worry it comes back.
Okay. You wear very thin long pants. You go to Decathlon, buy very thin yoga pant, very thin. It's very stretchy. we just want to avoid direct contact from the cold air to the
Yeah.
outer thigh.
Yeah.
You will see the sinus can completely gone.
Okay.
Okay, so now we talk about your hair drop problem. Do you have low blood pressure, anemic, multiple surgery, chemo, radiotherapy, multiple medication, removal of organ, or you're vegetarian?
No.
No, all this all
No.
Okay.
No. Just that I don't know whether I'm about to go into perimenopause but because the X39 actually helped me to have period returning.
Ah, amazing. Okay. Okay. So for the past 3 months, right? What are the biggest changes you have seen? Anyone say you look better?
Actually, the skin pores wise, I do notice it helps. And
What skin
you know
better?
the laughing lines I
Yeah.
think one side is better somehow. I
Okay.
noticed that.
Okay.
Okay, my nails
Amazing.
grow very fast. And I
Okay.
have the nail fungal.
Yeah.
On this part, I still can't see much. But then I do notice the nail kind of like, the colors or the white part.
Yeah.
Yeah, above the fungal seems to be
Yeah.
very cloudy. Yeah.
I see.
Yeah. And
Okay.
then I have one toe nail.
Yeah.
Very strangely, there's one straight blackish line.
Yeah.
Then and then this son at the same time actually had it on his thumb.
Yeah.
Yeah, so he actually Google and worry that it's cancer.
I see. And then do you find any changes on this black line?
No changes.
Okay. Then okay, but how old you are this now?
50.
50, yeah.
Yeah.
So they means your overall good changes is only the nail grow very fast and hard, and and then you mentioned something what
Actually, last time I don't have this line on my toenail. I
right.
don't know why it suddenly appeared.
I see.
Probably this year, yeah.
So that means for the past 3 months, the only result that is quite obvious to you is the laughing line disappearing, like one only. How about your
Skin,
digestion, your sleep,
digestion,
your bowel?
bowel. I don't notice if I patch 39. It is better, but don't guarantee every day.
I see. So your X39 ion for the past 3 months, is it consistently?
I use X39 more.
More as in, is it every day?
No, 3-4 days a week.
I see.
Yeah.
This answered the question already. Okay,
So-
we need the body to build the blood in order to build the hair. So if only 4 days, 3-4 days, it means only that means essentially you are using 40-50% of the power of the patches. Then a lot of my theory doesn't work already because my theory works for people with X39 ion consistently every day.
Okay.
Yeah, so really don't need to buy X49, don't need to buy Alavida. The key is save that money to focus on X39 and Eon.
Okay.
Okay?
Can.
Okay, don't worry. Because 3 months, right, if your menstruation is coming back, it means the blood is getting more already. Hair loss, hair drops. You should be seeing result by now for the hair drops on. If you have seen the changes in the menstruation, so maybe the womb is not there yet, you patch consistently.
Okay, there's one notice is that my dry skin on the feet actually is much better than the past.
Right.
Yeah, this is one observation.
Oh, this is good. That means the lung is getting better. Do you find your sinus getting better?
Oh, definitely.
Definitely.
This is very obvious. Yeah.
Okay. That means the lung getting better. That means your sinus also getting better. So this is if you can wear the long pants, you will see your sinus completely gone, and suddenly all the changes will start to come already because now your body is using a lot of blood to try to remove away the dampness from the lung and the sinus.
Oh, okay.
Okay.
Can. Thank you.
Okay. Thank you.
Yeah, and then there's a last question, sorry, because I have
Sure.
a friend with autoimmune system, and then I think after COVID, she says that that she took the vaccine, and then
Right.
she does a yearly health check, no
Right.
issue until few years ago, and then with the liver condition.
Right.
I forgot the technical name, but then she says that the doctor says there's no cure for liver, but then they prescribe a new type of approved drug. So I mean, I can tell she has jaundice. It's very obvious
Yeah.
and thin down . So very scary . she has science knowledge. Of course, bio is not that knowledgeable, but then she knows live wave and the stem cells. But then she still has concerns, reservations, because it will work on the the cell, our DNA.
Don't worry. So I think the most important thing, ask her to come to the Zoom. I will help you to do the talking.
Oh, okay.
Okay, you just let her know that all the changes have happened to you for the past 3 months only by patching 3 to 4 times a week. Think about this. If you patch it consistently, what are the changes? The menstruation come back at 50 years old, you know.
Yeah.
This is amazing. Amazing,
Yeah.
okay?
Okay.
Okay, thank you,
Thank
Tiffany.
you.
Thank you.
Bye.
Guys, 50 years old, menstruation, already menopause already, 50 years old after 3 months, only patch 4 days a week. Menstruation come back already at 50 years old. Laughing like get better, sinus a lot better, the dry skin no more, disappear already. Do you think it's amazing? Only 3 days, 3 months, but actually not 3 months, only 3 to 4 days a week for 3 months. And mostly it's still X39, sometimes even no ion, but you can have already this kind of changes already. You think it's powerful, these stickers? You think it's powerful, these stickers? If yes, that 555. You think this sticker is powerful? 3 to 4 times a week, and most time only X39. And 3 months later, the sinus improve a lot, dry skin no more, the menstruation come back. So this is why, guys, you see, this is why, right? A lot of theory that I built for you guys, the 6+6, the 7 health class, all the logical answer that you have from me, right, is all based on you use every day. Okay, if you use it every day, then all the philosophy I tell you, it will work. But if you don't use it every day, then it's very difficult. How to convince a client with, okay, this one we answer already. Okay, so I think someone asked me, CL Chu, I don't know, is it you are here, CL Chu? So I have done some research. You see, your hepatitis B viral load increase. But virus load increase not necessarily is damaging the liver. It can be a release of the. Okay, I give you examples. If today my door has a lot of termites, a lot of termites in my door. If I put an essential oil, go and smoke. Do you think by visual, I increase the number of termites? Like now, I don't see maybe 5 or 10 termites only. But when I put the essential oil to diffuse inside the door, right, do you think that visually it increase the termite? If yes, type 555. Do you think that it visually it increase the termite? Because all the termites start running out already because of the smell, right? So the termite has been there, but has been storing in the door itself, eating the woods. So the remaining we only see outside, so 5 to 10 termites. But in order to address these problems, right, we cannot just kill the 4 to 5 termites. We have to really remove all the termite inside. So when you remove all the termite inside, all the termite will rush out. And then you start to see, how come got so much termite? Last time I don't see one. Okay, so I believe this is a healing reaction for the liver. So I asked about this gentleman, and okay, so when I say gentleman means actually one of the teacher that I learned online. You look at ALT and AST, which is the liver enzyme. So if the hepatitis B go up, but the ALT, AST remain the same, it means that the door itself, let's say now the door, you knock, inside is hollow already. Maybe the lobang is like this. You inside the hollow, okay, here hollow. So when you do the diffusing, all the termite rush out, okay? And if you continue to knock the door, knock, the hollowness is remain the same. It's not getting bigger. That means it's safe. That means that the termite actually increase is because it is forcing up all the hidden termite. But if you think, wow, the hollowness getting more and more already, that means the termite is really getting more and more and more. So in life wave, what I see is this. If sometimes your viral load increase, like hepatitis B, your virus load increase in a sense, but other liver function remain the same, It means that life wave is forcing the toxin from the liver to come out because the enzyme shows that the liver is healthy. Can you follow what I mean or not? I don't know, is it too deep or not? Can you follow what I mean? If yes, type 555. I try to make it very easier to using door for example already. Okay, so if after, this is why when you use the patches, right, don't go for medical checkup so early. Okay, and if some people after finish treatment, some people before they use the patch, right, they already scheduled the medical checkup right after the 3 months period of using LifeWave. It always get haywire one. It's because of this. You force the termite comes out. Then now you ask you ask your friend to come to your house. Of course, you get scared by the termites, right? You need to get all the termites running out already. Then let the termites fails off. No more termites already. Then your body become different. How then could we advise them extra? You can Hong. Sarah, how about the heart palpitation? Can I use it on or other patches? Okay, Sarah Ibrahim, X39 Eon are the basic, focus on 3 months. But if heart palpitation really cause you have a difficulty in your life, right, you can definitely put a carnosine at the spirit gate. Okay, what you do is you can follow this book. Okay, please get a copy of this book from your friends, from your outline. Okay, it's here. Okay, it's here. Someone have stage 4 undergo chemo, Lydia, doing 3 months to, yes, X39 Eon. Start with X39 Eon for the 1-2 weeks first. Later on can go for CRP already. My friend patched EE because she has ringing sound in her ear, then got headache, so she stopped patching. Okay, if you want to heal, okay, all sort of ringing in the ear is definitely because of the kidney weakness, the circulation is bad. When you patch EE, you will get these kind of things. Okay, the thing is, guys, ringing in the ear, unless it's acute means that suddenly, boom, accident. You got a, this thing, life can help very fast. But if something is chronic for years already, right, don't give any hope already. Don't give any hope to people that there is miracle. They will definitely disappointed, and then they will miss this chance already. Might as well you tell them, if this one have been many years already, it's not acute, it's chronic one, it take long time. But we have seen good result with this. Okay, but if you go for surgery, it will run a risk of losing your hearing. Okay, but now you see, you only focus on the 18 quick fix for the fast reaction for people have this kind of symptoms. For people have chronic ringing in the ear, right? Mostly is a failure one, trust me. Jess, my auntie said after 3 months of using patches, she found lately her left neck is feeling numb on off and her leader uncomfortable pain when turn her left to the left. She's worrying if it will cause stroke. She eat rice normal, daytime maintain an apple, especially after pai pai. She do not understand English, so she's not in this room. Kindly advice. Jess, if her left neck start to feeling numb on and off, I don't know whether did she change any posture of her sleeping. If your auntie has been seeing many good changes for the past 3 to 4 months, only lately the left neck get numb on and off, you ask whether this area got problem before or not. Most often than not, she used to have problem here and stiff, but very stiff, and now it start to feel better. What to pack for someone has sweaty palms? X39 Eon. My forte, sweaty palm. I used to have very, very sweating palms. Now I still have when it's very cold and I'm nervous. But other than that, it's fine. Jinlong, do your session, you do recording? Yes, we have recording. Wow, scary. I thought I don't have recording. My knee joint pain comes back again. Is it because I walk too much in JB and cause the pain to come back? Or is it due to soya bean drink allergy? Most likely, maybe it's JB. Sarah, FYI, I'm having heart palpitation and shortness of breath already about 9 months. I've already checked out, but the doctor never give me any medication. So I would like to try the patch, but I don't know which patches is suitable for me for any problem. Please explain to me. And sorry, I'm tired to talk. No, okay. Sarah, I hope you are still here. That means your heart is very weak right now. It can't pump the blood. The most important thing is put the patch as soon as possible. You can add on carnosine at Vivigate here. Okay, and remember this, you must eat white rice. Make it soft. You can even take porridge. You need a lot of calories right now for your heart to pump. Okay, start with X39 in the morning, yawn at night, add on carnosine and heart palpitation. Okay, Caroline, my friend has scoliosis for more. Sorry, sorry, Caroline onwards, your answer is a little bit too late already. So I will answer tomorrow, okay? I will answer tomorrow, okay? Hong, 5th of August, I don't know why the Zoom didn't record. We had the transcript, but we don't have the recording. So there was a hiccup. So we don't have the 5th, and I'm sorry. If ladies already stopped the menstruation, is coming. Yeah, it's definitely a good thing because it's sign it's a renewal, youth renewal. Okay, I asked a question. If she heard mention, no. Yeah, she continue. Then the next issue is her heart getting better. When her heart getting better, a lot of blockage used to be there. It will start to feel a little bit discomfort. Okay. Okay, guys, I have seen many questions coming out, but it's too late already. If I answer you guys, right, then it will build our habit that you guys come very late and then ask the question very late, but people who came in 8:30 have to follow you through. So I will stop the whoever who asked the question after 9:30, okay? Okay, guys, thank you so much. Thank you so much. Good night. Amazing, right? You see how we can help people renewal, the skin getting not so dry, sinus have reduced a lot. We have seen people the hair texture change, the fungal nail improve. We have seen people the appetite get better, can sweat just with couple of months, 2 months, 3 months of life wave. If you follow whatever we have teach you, right, for sure you'll see the result. And those kind of healing crises, as long as you focus on X39 Eon, the healing crisis will not be too unbearable. If really unbearable, you can always reduce the number of hours. And the thing is this, you always have to make a decision. Either you don't do anything, it is also a decision. So if you want to heal better, like just now Siu Kim, either you head on the healing crisis or you avoid the healing crisis and always live in fear. If you want to choose to live in fear for the next 10 to 20 years, don't want to heal, don't worry your healing crisis, just because you worry your healing crisis, you might as well wasted the few decades of your life, right? This is your choice. But if you think that, why, if I can just give this 7 months to get rid of all my symptoms, all my problems, I can live another 30 years of my good life, right? 7 months for a 30 years of good life, worth it. Then you'll find the right place already. We have the resources for you, we have the help for you, we have the product for you, we have the education for you. What you just need is have patience and have the kind of clarity to know that this is how the body functions. Okay, bye bye, good night, take care.